Hi everyone. In today's video, I'm going to be going through the 5 factors that define blood vessel resistance and the flow of blood through those vessels. Now, these 5 factors are indirectly involved with defining blood pressure because since blood flows within the vessels, it seems logical that changes to these blood vessels will impact the force at which blood flows through them. Now, these 5 factors are quite simple to memorize and know because they are all related to, in some way, or mostly I should say, are related to the walls of the blood vessels. So, the first factor that we're going to talk about is blood vessel wall radius. And this should seem as one of the most obvious ones because essentially blood vessel radius is what defines the size of the lumen of the blood vessel. And if you've learnt about the autonomic nervous system and parasympathetic and sympathetic control, you'll know that if we dilate a blood vessel, then we reduce the vessel wall resistance by increasing the radius. It's essentially defined by if we have the tunica intima here and we increase its size, then less blood is coming in contact with the wall vessel and more is flowing in a laminar direction through the center of the blood vessel, which means that there is less resistance. And this decreases blood pressure as well, because if you've already seen my videos on the renin-angiotensin-aldosterone system or the ANP cascade, you'll know that increasing the size of a container whilst maintaining the same volume of the liquid within that container decreases the pressure. The next aspect that defines the flow of blood through a blood vessel is the smoothness of the wall. And once again, this is a pretty self-explanatory aspect because the more rough the rougher the wall of a blood vessel is, the harder it is for blood to flow through that wall. So for example, aspects that can cause an increased roughness of the wall may be aspects such as an atheroma, such as an atherosclerotic plaque, and these plaques extend into the blood vessel wall and allow for a disruption in the laminar flow of the blood vessel liquid, so the blood that is inside the vessel. And if more than 80% of the blood vessel lumen is occluded by that atherosclerotic plaque, then the flow of blood moves from being laminar, which is a smooth flow, to being turbulent. Other factors that can affect blood vessel wall smoothness can be the presence of an excess amount of platelets maybe within the blood. If there is any blood vessel damage of any kind and there is exposure of the underlying layers of the blood vessels, such as collagen or smooth muscle cells, then that can also affect the ability of the vessel wall to be smooth. And the internal and external elastic lamina also define the blood vessel wall smoothness. If there is a high amount of elastic recoil by elastic fibers, then the vessel wall smoothness is likely to be high as well, because the blood vessel is able to effectively change its vessel lumen size in the flow of blood as it flows through the vessel. So if I were to draw that, essentially if we have a normal blood vessel here, and all blood vessels are a little bit wavy in their appearance because of the irregularity of the tunica intima, compared to a blood vessel which has an atherosclerotic plaque, which will obviously impact the ability of blood to flow through. The third factor that affects the ability of blood to flow through blood vessels and essentially the blood pressure is the viscosity of the blood. And the viscosity is the ability of blood, so essentially the ability of blood and its ability to flow and its ease of the flow. An example of a substance that has a high viscosity is honey. So if the blood is has the same viscosity as honey, then it's unable to flow through the vessel in an effective manner, and that essentially increases blood pressure because the higher the viscosity, the greater pressure there is against the vessel walls because there's more stasis of the blood. As opposed to if the blood is more watery, then there will be a lower blood pressure and lower blood viscosity. So the blood is able to flow in a much smoother manner. So the viscosity is a major thing. The fourth aspect relates to the vascular tone. And the vascular tone is essentially the sympathetic nervous system innervation that exists at all times on a blood vessel. So as you all know, blood vessels are never really relaxed. There is always sympathetic innervation of a blood vessel that allows for it to maintain its structure. So changes in this vascular tone will affect how much the blood vessel provides resistance or an increase in blood pressure to that particular area of the body. So there are two main scenarios that can allow for an increase in vascular tone. Firstly, as I've already mentioned, there can be an increase in sympathetic outflow, which increases the resistance by reducing the radius of the blood vessel, or there can be hormonal effects on the blood vessel. So key hormones such as thyroid hormone, and adrenaline can both allow for a constriction in blood vessels to allow for a greater vascular tone and therefore a greater blood pressure. Now the last aspect is vessel length. Now, vessel length doesn't really relate to the lumen of the blood vessel as we've seen in the past 4 factors that we've talked about, but it rather relates to the length and the cumulative resistance that a blood vessel has as blood flows through it. So, for example, if we have blood flowing through the coronary circulation, as you all know, the coronary blood vessels are quite small blood vessels in terms of their length. All they have to do is flow from the aorta to the myocardium. And as the myocardium is quite close to the aorta, these vessels have quite a small length. So there's going to be low resistance. On the other hand, if we take for example, popliteal artery, that artery extends all the way from the aorta to the lower leg. So as blood flows through it, the resistance is going to increase. Now, blood vessel length can increase in 2 main mechanisms. It can either increase in an anatomical, so a physiological manner, or it can increase in a pathological manner. So, as you all know, from the point that we're born, we're constantly growing. So that means that compared to a baby, in which the blood vessels are comparatively shorter in length, an adult has much longer blood vessels. So naturally, that's going to mean that blood pressure is going to increase because naturally blood vessels increase in size because the person itself increases in size. So blood pressure is going to increase. So that's a physiological or a normal process example of where blood vessels increase in length and therefore increase the blood pressure. A pathological mechanism that occurs that increases blood vessel length and therefore pressure is when a person increases in size, but that increase in size is located around their central abdominal area, meaning that the person becomes more overweight or obese. So in that case, since the person's size has increased, but obesity is not a natural process, there is an increase in the length of blood vessels because blood vessels try to compensate for an increased body mass by increasing their length, because essentially now organs have become further from each other, and that means that there is an increase in the blood vessel resistance because an increase in length means an increase in blood pressure. So as you can see, both blood vessel length can be influenced by both positive and negative processes. So as a quick recap, if we look at the 5 aspects that we've looked at so far, radius has probably the most direct effect on blood vessel pressure and resistance, since it allows for an increase or decrease in the amount of blood that can flow through a blood vessel. Secondly, the smoothness of the blood vessel wall influences blood pressure. If the vessel wall is smoother, it's allowing for a laminar flow of blood. Viscosity is affected as well, since if the blood has a high resistance to flow, then it's unable to effectively allow for maintenance of low blood pressure. If there is an increase in vascular tone, then that essentially means that either sympathetically or through hormones, which I'll quickly just write here, we can increase the blood pressure to an increase in blood resistance. And finally, vessel length, which can be physiological through growth or pathological through obesity. So I hope all of these things that I've talked about, all of these factors have made sense today. Thank you very much for watching, and I'll see you in the next video.